Hi, my name is Kristen Calhoun, and in this video, I'll be showing you pericare of a male. First, before I get started, I want to tell you a little bit about my patient. As you can see here, this is Mr. London. I had his cover pulled back because I wanted to show you a couple of things before we get started. So Mr. London is a 35-year-old male. He has recently suffered a motorcycle accident, and he's new to us at our facility. I like to be as real as possible. That's why I use so many tools and everything, just because I want it to be as real of a clinical setting as I possibly can, so that I know if I'm doing things right. With that said, Mr. London is a minimal mobility. However, he is a total care patient. He can talk, but he needs assisting with feeding, bathing, and other things. Another thing, Mr. London has a catheter, Foley catheter. That's what I have down here. This is a sitz bath, so this is locked for mess purposes, because if I unlock this, the water will go everywhere, because it's a reverse, because of course, you know, the sitz bath is reversed than a catheter. But this is, again, so I can have it as real as possible. So this will be the drainage bag, of course. What I also have in place for Mr. London is I've kind of got a replica of a male genitalia area. So as you can see, would be the penis and the shaft. This right here is just a water bottle cut in half. And down here is the bottom of the other half of the water bottle, and that would be the scrotum. I'll lay him down for the rest of it. Another thing Mr. London has as well is he gets nasal oxygen. So this is his nasal cord that he has. These will be with the straws I put there. And then this is just to hold it in place, and this is just ribbon. He does have gauze already in place, and let's just say for clinical purposes, this was from the last student's care. All right, so now that I've explained the setup and told you a little bit about my patient, I'm going to go into my clinical skill. I'll be right back. Hi, Mr. London. How you doing today? Good, good, good. Well, my name is Kristen. I'm a CNA student from PG Community College, and I'm here to give you a pericare for male today. Is that okay? Good. You want to know what that is? I get it. That was the technical term. So what I'm going to do is I'm going to clean your private area if you're okay with that. You're good? Okay. Okay, if you just give me a couple minutes, I just want to get a couple of things to get a couple of my utensils so that I can help serve you better, okay? Okay. At this point, I'm going to close the privacy curtain, and I would wash my hands, and I would grab my utensils. However, I do have my utensils already in place, so I'll go over them with you before we get started. I have a waterproof pad, just in case if water spills, anything to keep the bed from getting messy. This is a personal cover sheet, privacy cover sheet, excuse me. I also have about 5 washcloths here. My intention is to use at least 2 to dry. Actually, I'll have another cloth too. We'll go ahead and pull another clean towel for the back part. So I'll put that right down here. I like to have my stuff in order so that as I'm pulling, it makes it easier. This is a basin bowl, and it does have water in it, and I will have Mr. London check to make sure it's the right temperature for him, and this is soap. Okay, Mr. London. Okay, excuse me. Remember, I've already washed my hands, and now I'm going to finish the Pericare. Okay, Mr. London. I'm going to grab my gloves here, and we're going to go ahead and get started, okay? Okay, good. Glove broke. There we go. Okay, so what we're going to do first, Mr. London, is I'm going to put a waterproof pad down just so in case I get messy. I'm not perfect. And I'm going to have a privacy cover for you too, okay? Okay. So let's go ahead and pull this down for you. There we go. Still feeling okay? Okay, good, good. All right, next, Mr. London, I'm going to help you. You don't have to move at all. I have you. I'm going to help you move towards the wall, okay, so that I can get the waterproof pad underneath you. Remember, he's a motorcycle patient. He just recently was in a motorcycle accident, and he's on limited mobility. So what I'm going to do is I like to kind of pre-fold, again, towards me, but I like to pre-fold the waterproof padding so that they do not have to move, but so it's really quick and painless for them. This worked for me when I was changing my mom's bed. It was really quick for her. She liked it. So, all right, that's there. Okay, Mr. London, on 3, and like I said, just I have you. Don't worry about anything. Okay, I'm going to move your catheter over just a little bit so that you have that give. Okay. All right, on 3, I'm going to roll you towards the wall. You don't have to do anything. Just stay completely still, okay? All right, ready? 1, 2, 3. There we go. Good job. Good job. I did use the pull sheet just a little bit to help me roll him, log roll him a little easier. That way he also felt like he had support when I was doing it. Waterproof pad. Put it right underneath him as close as possible. Okay, Mr. London, on 3, we're gonna roll back and you're gonna feel a little bump, okay? 1, 2, 1, 2, 3. Roll. Ooh, there's the bump. There we go. Okay. One more time. We're going to come towards me, and do not worry, I have you completely. Ready? 1, 2, 3. Good. Roll. All right. You're good. You're good. Roll back. Okay. Good. Good. All right. Now, I'm going to start with my Pericare. So I have his waterproof pad, his privacy cover. I'm going to go ahead. All right, Mr. London, if you don't mind, I'm just going to pull up your gown here just a little bit. Got your gown around your catheter around your gown around your catheter. Don't worry, I have you. Feels better? Good. Okay. So we're just going to pull that up just to about the navel to give us room. Keep that there. All right. Another thing I'm going to do too, before I get started, I'm just going to make sure that the urine is traveling towards the drainage bag properly, and kind of just making sure it comes down. Okay, good. So now my first cloth, I'm going to put in the basin bowl. I'm going to rinse, and I'm going to fold it into a triangle, but with like this. Boom. To where I still have the 4 layers. And now I'm going to apply my soap. Get a good lather. Okay, Mr. London. I'm going to lift up your privacy sheet here, all right? And I'm going to start with your penis, okay? I'm just going to lift up and I'm just going to start to wipe, all right? Please let me know if you experience any pain, okay? So now what I'm going to do is I'm going to grab the shaft of the penis. I'm going to start at the bottom, underneath, but at the tip where the urethra is at the tip. Go around and down. A new sheet, new fresh clean sheet. Again, we'll start at the bottom, go around the tip on the urethra, and go straight down the shaft of the penis. Flip again. I'm going to take a new sheet. I'm going to grab right here at the tip where the catheter is, and I'm going to just clean down about 3 to 4 inches. I'm going to do the same thing again. Come down, clean down about 3 to 4 inches. New sheet again. Now I'm going to do the scrotum, and I'm going to come here and I'm going to go straight back. New side, straight back. Make sure to keep them covered. This is soiled. Goes in the soiled linens. Okay. All right, Mr. London, now all I'm doing is just going to come back and wipe you off, okay? Fresh cloth. We'll go ahead and fold it again. All right, I'm lifting the privacy cover back up. I'm just going to wipe you off here. We're going to rinse you off. Grabbing the shaft again. I'm going to start at the underneath, at the tip, where the urethra is. Go around, straight down to the shaft. Peel back, around, and straight down the shaft. Peel back. The tip of the catheter, right here at the tip of the urethra, and then come on down about 3 to 4 inches and wipe. Do it again, 3 to 4 inches and wipe. Clean, straight down, and straight down the scrotum again. Dirty. I'm going to grab one of my colored washcloths to dry the area, and then we're going to flip over and do the back side. Okay, Mr. Young, I'm just drying you off, okay? And you dry down, not up, dry down. So we're going to do that again. Come on the other side and scrotum and dry down. Okay. All right, Mr. London, we're going to roll one more time. This time, this goes in the dirty linens. One more time, we're going to roll towards the wall, okay? And I'm going to wipe your back side. I'm going to move my table a little closer because remember, he's a limited mobility patient, and he's just recently experienced a motorcycle accident. So I'd rather have my utensils closer to me so that I can support my client. Okay, Mr. London, on 3, we're going to roll you. I'm going to help you roll towards the wall. Now, when I say help you roll, I don't want you to do anything. I'll do it all, okay? All right. So, again, we're going to grab the catheter here. Just make sure that that tube has a little bit of give for him as we roll him. And make sure it still has a good flow, and I see it does. Okay, ready? On 3, I'm going to use my pull sheet again to help to roll him. On 3. 1, 2, 3. There we go. Good job, Mr. London. Good job. Okay, so now we'll say that's Mr. London on his backside. And just so you can see, this will be his butt area, and we still have the scrotum just a little bit. That's important. I'll tell you why. Okay, so Mr. London's good. New washcloth goes in the water. I'm going to rinse that off. soap. Make sure it is good and sudsy. All right. Okay, so now this part we're gonna start at the scrotum, and this one I'll do the full way. I won't fold it, but I will still use my four fresh squares. So for this part, we're gonna start at the scrotum and come up. Okay. So we're gonna come down here where the scrotum is, and we're gonna wipe up. New. Scrotum, wipe up. New. Scrotum, wipe up. New. Scrotum, wipe up. Soil linens. It's in there. This is what I have the bigger towel for. That's all ready to go. Okay, so last thing before we use the towel, we're going to take our last washcloth here, and we're going to rinse. Have it in my four corners. Again, scrotum to up. So we're going to do scrotum, up. Again, scrotum, up. Again, scrotum, up. And again, scrotum up. Put that down. Dirty linens. I know I would not throw in a clinical setting. However, my basket is further over this way. But just for contamination purposes, I didn't want to grab my basket and pull it this way. I already did that for my table because I do have a barrier down. This is my towel. And I'm going to go ahead and pat him dry. That's in the dirty linens. At this time, while I have him on his side, I'm going to go ahead and roll up his waterproof padding here. And I'm going to, come on, Mr. London, you can go ahead and roll back on your back now, and it will be a hump. Boom, good job. And roll one more time for me. 1, 2, 3. Boom. I'm gonna get, and then this is his waterproof pad. Again, dirty linens or soiled. Since this is a reusable one, it will go in the linens. Okay, Mr. London, I'm gonna put you back on your back, okay? All right, 1, 2, 3, boom. All right. Okay, now I'm gonna pull off your privacy cover, okay? And I'm gonna pull this back down for your robe. Woo, feels good, huh? All right, good, good, good. Dirty linens. All right. Make sure your catheter's not in your way. Okay. We'll pull dirty linens. Okay. Now I'm going to move my table out my way here. Move it back just a little bit. I'm going to change my gloves before I pull up his sheets because we didn't change his sheets just yet. Let's just say that they're still fresh. But I still have a little bit of cleaning up to do. So I want to stay as sterile as possible. Okay, Mr. London. You doing okay? Good. Okay. So now I'm just going to pull up your thing here. All right. Got you. Good, good, good. All right. Good to go? Okay. Where's my call bell? Call button. Here's your call button. Let me put you back at the lowest position. All right, you hold on to this right here. Now, I'm not quite gone yet. I'll still be in the room. I just have some things to clean up, okay? Okay. All right. I'm going to pull back my privacy curtain, and I'm going to go ahead and continue to clean. Now, right here, I still have my basin bowl, and I need to clean that out. have water that I'm getting now off camera. All right, have my water. And then this towel right here, I'm just going to use to rinse out my basin when I finish. Put my soap up. Okay, so I already have a bowl right here that I was going to pour everything in. So to the side here. Okay, so I'm just going to pour that in. Have my fresh water. Now my clean basin bowl goes over here. And that water bowl, that was like my bedside commode. Okay. All right, Mr. London. Looks like we're all cleared and set up. If there's nothing else I can do for you, I'll be back in a little bit to check on you, okay? Okay, cool. Taking off my soiled, my dirty gloves, throwing them away. Then I would wash. And that's it.